First name is Andrew. I am 57.
Andrew suffers from asthma, a chronic lung disease. Andrew shares his story about how pulmonary specialist Dr. Mario Castro with Washington University School of Medicine in St. Louis, Missouri, found the answers he desperately needed to get his severe asthma under control. According to the Centers for Disease Control and Prevention, more than 18 million adults and 6 million children currently have asthma. This amounts to nearly 8% of the population in each age bracket. Asthma was linked with 2 million emergency department visits and more than 3,600 deaths in 2014. But doctors would say that most of these could have been prevented. Pulmonary specialist Dr. Mario Castro explains symptoms and points out the effect of asthma on the windpipe as the airways become inflamed and thickened and obstructed by fluid and mucus.
The classic symptoms of asthma are shortness of breath, wheezing, chest tightness, and cough. Our patients often will have those symptoms during the day when they're exerting themselves, when they're exercising, when they're sometimes just walking up the stairs. They'll have that shortness of breath hit them. Windpipes are depicted here enlarged, and this is a healthy windpipe. You can see here the center of the windpipe, it's open so you can breathe through it. And then over here on the left is that windpipe that's inflamed from asthma. And that inflammation causes swelling here and also mucus to be produced there. If it's happening more than twice a week, it's probably not well controlled. Some of my patients, they find themselves basically just spending their whole day treating themselves and trying to get their disease under control.
For those with severe asthma, symptoms come more frequently and sometimes require the use of a rescue inhaler or nebulizer several times each day.
My asthma had been under control for literally 17 years, no problems, no use of my rescue inhaler from year to year, and then all of a sudden everything just quit working. So I'm an engineer at a plant, at a manufacturing plant. So I have a lot of walking to do. I have to climb stairs. I would run out of breath climbing stairs, which hasn't been the case when my asthma is under control. I have a nebulizer, which is something that helps me more than a rescue inhaler will. I was using my nebulizer probably every 3 hours throughout the day. And towards the end of the week before I went to the emergency room, that wasn't working either. So basically I was short of breath, couldn't breathe. I went to a pulmonologist in Hannibal, I went to a pulmonologist in Quincy, I went to an allergist in Quincy, my regular doctor several times. There's nothing anybody else they didn't know what to do. They just kept trying new medicines.
Eosinophilic asthma is one specific type of asthma that may not respond to traditional asthma treatments. One way to diagnose this type of asthma is through blood work, which may provide answers for some people who are not finding success with traditional treatments.
Objective testing, careful testing allows us to really make the accurate diagnosis and then get them on appropriate treatment.
In August, I was diagnosed with eosinophilic asthma.
Eosinophilic asthma is often severe, though the cause of is unknown.
That group of patients has their disease process driven by this inflammatory cell, the eosinophil. And so what we know now is, these cells, these eosinophils, are really critical in driving disease process like severe uncontrolled asthma.
Eosinophils can be seen through blood work, mucus sample, or through a biopsy. What doctors worry most about with eosinophils is that they release toxic chemicals called interleukin-5.
Interleukin-5 is a molecule, cytokine, that drives inflammation and drives the eosinophil into the airways. And so we found out that if you can inhibit that molecule with an antibody, we found that controls the disease much better than steroids, and it has minimal side effects.
Anti-interleukin-5 antibody treatments, often given either intravenously or by injections, have been shown to reduce the number of eosinophils that contribute to inflammation and help minimize asthmatic reactions. This therapy is approved for use to treat severe asthma in adults who have an eosinophilic phenotype of asthma.
The treatment plan I am on now has me like I was before my asthma went off and got bad. I am not using my rescue inhaler. I have not used it since the first treatment. It started working that fast.
Asthma can be a manageable condition when diagnosed and treated properly. Physicians in all practice areas should flag unmanageable symptoms and bring on an asthma specialist as needed to help identify the right diagnosis and better treatment protocols for the patient who has little to no relief from existing treatments and who may be experiencing increasingly severe symptoms.
It's really recognizing persistence of these symptoms, the shortness of breath, the coughing, the wheezing, or the chest tightness. I do encourage patients to be their own advocate because it's important.
Andrew also weighs in on how to get answers when your asthma is uncontrolled.
Keep pushing the doctors and keep going to different doctors until you find one that fixes you. I am back to living completely normal, 100% normal.
Thanks to diagnosis and effective treatment, Andrew is back to enjoying his time with his family, in Bible study, and staying on track at work.
I feel better than I have in a long time.
This educational video has been brought to you by the American Partnership for Eosinophilic Disorders, a nonprofit advocacy organization dedicated to improving the lives of those living with eosinophilic disorders, and a generous grant provided by Teva. For more information about eosinophilic asthma and other eosinophil-associated diseases, view the extensive resources available from AppFed at appfed.org.